Question number 11, what can be done for levator ani syndrome? Levator ani syndrome is more of a pelvic floor spasm is a better way to think about it. So if you have the pelvic floor muscles, so for example, this is the pelvis right here. There's the muscles you can see inside and from underneath here in the red. So there's a lot of pelvic floor muscles, and so some of them or many of them can be spasmed. So if you think of a Charlie horse where you have your calf muscles are squeezing, well, you can stretch your calf very easily and stretch out that muscle, that spasm. Well, the pelvic floor is very, very difficult. You can't stretch those muscles out very easily. So the pelvic muscles are very difficult to stretch out, as you can see here. You don't have feedback like you do with, say, your arm. So if you have your arm, if I say contract your muscle, your bicep muscle, well, you can see your arm moving. So you get that visual cue, that visual feedback that your arm is moving. The pelvic floor isn't the same way. So one way to check is to put your finger in the vagina, like your thumb, for example, and then you can squeeze and then, or feel if you can relax, because a muscle has to both contract and relax. The pelvic floor is exactly the same way. So if there is pelvic floor spasm, one of the things that we can do is use a dilator. So we give patients this device, for example, and they can put it in the vagina and then push down, usually on the back wall, and gently push it and stretch it out. It's just like a massage, essentially. I definitely would recommend people who have pelvic floor spasm to see a pelvic floor physical therapist. And they can do a lot of manual work, meaning put their fingers in the vagina and push on those specific muscles to try get them to relax. Sometimes if that reaches a plateau and it's not working as much, sometimes we can do even Botox injections into the pelvic floor muscles.